Good afternoon, everybody. My name is Clay Teague, and I'm this year's No HIMSS Ohio president. For those that don't know, on behalf of the No HIMSS board, I'd like to thank you all for being with us today. Today's webinar will be a panel discussion with industry experts covering opportunities and challenges for AI in healthcare. Steve Roesing, CEO of ASMGi, will be leading the panel discussion, and I know they have lots of topics to cover for us today. So I'm going to quickly turn this over to them, and without further ado, let Steve kick this off. So thank you, Steve, for being with us today and leading this discussion.
Awesome. Thank you very much, and thank you all for being here today and sharing your time. We have a great topic and a great panel of experts today. So I'll just go through a little bit and then ask you guys to introduce yourselves, right? But I'm Steve Roesing, President and CEO of ASMGi. We're a full stack technology company, so we get involved in IT, software development, and security initiatives. Basically, who I have with me today, Piyush Mathur, he works for the Cleveland Clinic, which is a member of Northern Ohio HIMSS. So great to be here. Great to have you here, Piyush. He's also the founder of BrainX, which is an AI organization, and you can explain a little bit about that, Piyush. Also with us today, Driesser from Germany, from Siemens, and Ivo is the global head of marketing for AI, and Suman Mishra from Gas Technology is with us as well. Thank you, Suman, for being here. Piyush, why don't you go ahead and kick off your own introduction? Tell us a little bit about yourself.
Yeah, thank you, Steve. Thank you, HIMSS, for giving this opportunity to be here. I'm an anesthesiologist and an ICU physician. So if you're wondering where I've been last few years, I was dealing with COVID, not personally, but taking care of these patients. But also serve as the quality officer for Anesthesiology Institute, and that was my impetus to see how we can apply advanced data technologies such as AI to healthcare to improve quality of healthcare delivery and safety. So I ended up co-founding BrainX, and BrainX community has two organizations which are for AI and healthcare.
Awesome. Ivo, go ahead.
Yeah, thank you very much, Steve. Thank you very much for the opportunity to be with you today. My name is Ivo Driesser. I'm working in the Siemens headquarters, so I'm the only one not being in America today, joining you from Germany. I'm based in the headquarters, taking care about marketing and all the topics around AI that are used in clinical routine. And yeah, I'm really looking forward to the discussion today.
Awesome. Thanks for being with us, Ivo. Suman, go ahead, please. You're muted. You're muted, Suman.
Okay, I was trying to unmute myself. I apologize. Hi, everyone. This is Suman Mishra, and I'm really thankful for this opportunity to attend this webinar today. Let me introduce myself. I'm part of GS Lab Gabs Technologies, which is predominantly healthcare technology solutions company, has products and services, so mostly providing solutions to healthcare providers, payers alike. Prior to my tenure in GS Lab Gabs, I was part of Kaiser Permanente, where I got exposure to healthcare for the last 14, 15 years in several capacities, starting with Medicare, Medicaid, ACA, going into enterprise architecture, cloud, and then digital health, which includes chatbots, chronic and episodic condition management, neuroscience-driven patient engagement. So was privileged to be part of that. My intent today is to participate in this conversation to educate and learn as the process goes through to understand what the impact AI has in current healthcare domain, and how do we make an impact going through AI as our vehicle to make that impact. So thank you for this. Back to you, Steve.
Awesome. Thanks for being with us, Suman. Go ahead and move the slide to the next one, please. So here's what we're going to talk about today. Some introductions. We're pretty much done with that. Trends in AI. We'll talk about that a little bit, and then we'll do some questions to the panel. really want to leverage your expertise and let you guys do most of the talking, right? And then we'll open it up for audience questions. So hopefully you brought some or developed some throughout the thing. Next slide, please. Okay, so the World Health Organization, basically, here's what they say about artificial intelligence. It's on the rise, right? So we see a lot of health systems really implementing artificial intelligence, and like Siemens has been doing it for a long time, right? So, but in any event, the impact, I think, to the patients, right? Health to the individuals, health is limited, right? It's less than, and you can read these articles. We'll deliver these slides to everybody afterwards. But if you can move to the next slide, please. The other thing I think that's worth noting is the market is growing, right? So even in the U.S. Alone, right, 36.1% compound annual growth rate projected for the 10-year period from 2020 to 2030. So we see a lot of growth and a lot of there's a lot of room for, I'll say, expanding upon what's already implemented in the world. 2021 through 2030, 7 years, 9 years actually. We from 11 billion to 188 billion, right, in revenues, 37% growth. So next slide. But we see a lot of AI implementations in healthcare. When I think about AI or machine learning, what I like to think about it are really three buckets from a functional standpoint, right? So you have to acquire the data, right? So you have to get the data from somewhere, and you have to train the models and do all those things. But in any event, even the live data has to come from somewhere. So it's either going to be generated by devices in a digital health scenario, or it's going to come from databases, right? So people collect data, and we see data in the enterprises growing pretty fast, but you have to have the data in order for artificial intelligence to work, right? And then you feed that data to a model, right? And the model is mathematical in nature, and it's designed for a specific purpose, right? So we see models that do specific things, right? So depending on what outcome you want to achieve, that will drive or dictate which model you use. And the general practitioner doesn't really have to make that decision, right? It's going to be made by a data scientist in most cases. But I try to put a few examples up, and then from there, once the model crunches the data, right, the numbers, and then you have to display it or visualize it in a meaningful way, depending on who the audience is. And so I think if you kind of think about AI and machine learning, artificial intelligence and machine learning in that way, then it'll be helpful to talk about a lot of other things that can occur, which we're going to talk about today. So if you can advance to the next slide, please. So I put this slide up. There are tons of reasons why artificial intelligence is growing in popularity and use, right? And that's because of the outcomes, right? So, and the efficiencies, and it's hard to hire people, and all of those reasons are driving the rapid growth of artificial intelligence. But from a device standpoint, I think this is an interesting statistic. There are projections about how many devices are in the world, and I think currently about 43 billion devices. In the flip of the calendar, right? 43 billion devices, and we see it ramping up pretty quickly. It's exponential growth, but devices around the world, it really applies to all industries are going through a digital transformation, and so all industries are dealing with this rapid growth of devices. But IoT devices in healthcare, it's specific to medical IoT devices, right? Or IOMT devices. There is a new term that like if there weren't enough acronyms already, right? But a new term that's been developed called XIoT, which basically is meant to encompass pretty much everything. But anyway, this slide really demonstrates that the devices in the smart home, the smart building, in the hospital, in manufacturing, in all those places, right? The devices are increasing pretty rapidly. Go ahead and advance, please. And so what I like to demonstrate, I like this slide a lot because it talks a little bit about some of the challenges with device level security. And one of the challenges is, that basically software developers, the people who are developing these devices, a lot of times they're so motivated to get the device developed that they release it before they implement, security or those types of things, or do a risk assessment, or really evaluate the unintended consequences that are going to potentially can come with it. And so we see a lot of that going on. And really what I like about this slide is it talks specifically about healthcare. There's a 25% cost savings in healthcare based on implementing devices at this level. And so when we think about artificial intelligence, it's probably even more than that, right? Because there's a lot of artificial intelligence that the data doesn't come from the device specifically, right? In digital health or in home health, a lot of times the data does come from a device. But anyway, I think it's significant. 25% is astronomical, right? It's a big number if you think about it. Go ahead and advance the slide, please. So let's get to some panelist questions. You go ahead and advance to the next slide. And basically, what opportunities are you all seeing in healthcare right now? And anybody can answer this question, but go ahead, please.
When I look in Europe or globally, also from a Siemens perspective, there were like two big topics that we try to support healthcare providers with, is to create a better clinical outcome. And the other opportunity we see is improve the workflow due to AI-based automation, so to say. So these are like the two big pillars we're actually working on, where we also have like the solutions in the field where we see accuracy increase next to the smoother workflow, so to say, where we see like time gain when it comes to reading and reporting.
What do you think about this, Suman or Piyush?
Yeah, so I was looking at the slide and I was kind of gathering my thoughts as well. If we were to think through this, I personally feel that it is still an exploratory nature, right? Because most of the stuff we're talking about here, like drug discovery, diagnosis of disease and other things, they're truly the North Star. But if you look at what is happening today in the industry, is it's going through a cycle of implementation, and that comes with a lot of, I always take it as a 4-step process, right? It has to be accurate, it has to be relevant, it has to be trusted, and then it has to go through the adoption cycle where every business unit under any healthcare organization adopts to that. But if you look at what the trends are today, big tech is coming in with a lot of opportunities, and we will talk through the presentation about that. But I think the relevancy is the key in my mind. Like when you come with that, how close are you to the actual real life problem where tech meets the real world, where actually caregivers are kind of providing solutions in a care delivery setting. So in that way, I feel it's still exploratory. It has a lot of potential, but those 4 things, trust, relevancy, and adoption, and making sure that it is accurate for us to use, is probably where it will take us to the next level.
How much of it is hype and how much of it is real? I mean, how are people getting value out of artificial intelligence today?
I can briefly talk, and then Piyush is an expert in this, and I'll yield to him as well. I think there are pockets where there is truly a different kind of impact that AI has created in healthcare. For example, going through several journals, and this was in one of the School of Medicine implementation I was involved in, a human being cannot go through so many journals to get to the solution that somebody desires. And give with certain bit of accuracy. That is just a machine thing. It's not a human thing. But human beings can take that information and make judgments or decisions, and that's probably a human thing, should not be a machine thing. So I think there are areas and where we will talk more about the AI use cases, but there are areas where AI has made a significant impact in terms of doing things that we couldn't do, human beings, in a shorter time. But there are areas where I think, like I said, it has to go through those 4 steps to be more adopted.
I read an article actually, and I'll get you to chime in on this a little bit, Piyush. I read an article, humans can basically handle 4 variables, right? And when we add a 5th, like a lot of the challenges that it seems like we face, and healthcare is notorious for this, right? There are so many different places where I think artificial intelligence can help out, or machine learning can help to do those 2 things that you talked about, Ivo, like either, improve care to the patient, or, minimize the workload on the staff and those kind of things. But if you add a 5th variable, humans are lost, right? They don't even know where to go. They don't know how to handle a 5th variable. And a lot of the problems, it feels like, that we have to challenge today have a lot of variables, right? So what do you feel about that, Piyush?
Yeah, well, that was my start of learning process after I finished my quality fellowship, because I was handling too many variables and I was struggling to pivot my Excel sheets. I say that story all the time. And that's why I had to learn some better advanced data techniques. And that's where I stumbled upon machine learning and AI. Like, being a physician, the last time I did math was like in 12th grade. So you can imagine what I had to go through after that. But I think from the perspective of where can AI make an impact in healthcare, I would say everywhere. At the base, AI is essentially a data-based technique. So wherever you have data, you can apply it. One of the things that we as a BrainX group has been researching is what's happening in the publication landscape. And we have been curating this data over the last 4 or 5 years. We recently published our research paper, which is in preprint, and you can go to brainxai.org to look at that. I was trying to put it on the chat, but I was having a hard time with that. What we did was to look at the quantification of publications, which is representative of the research work, the implementation aspects, and what are the outcomes of these applications when they implement. We also looked at a qualitative assessment of these publications. So are these mature publications? Are these not mature publications? Something that Suman was talking about. Now you're having like thousands of publications every year. Like, how do you sort through them? And guess what? We actually used a deep learning method to classify them into mature or not. So we used AI's help to classify AI in healthcare publications. And it's really interesting how every aspect of healthcare is being touched upon. But let's take a step back for a moment and see how these opportunities have evolved. So if you go back to the starting of 2000s or so, most of the work was focused on predictive analytics because you could only deal with some amount of like structured data or so. And then came the ImageNet revolution and so on and so forth. And that's where you saw all these applications around image analysis being developed. Started with chest X-ray interpretations, going to CT scans, now colonoscopies, then echocardiograms. A lot of these are functional. We are actually using these devices now, these AI-guided devices. We're actually using them at bed space. So it's not a matter of where it can impact. It is actually impacting healthcare. It is helping clinicians right now. And what I see happening is the advances in large language models. And that's very exciting because that's my field of research. And a lot of data in healthcare is text-based data. So that's what's being heavily researched now, and especially with, of course, we can't stop talking about ChatGPT. That is something that we are very excited about at this point of time.
Awesome. So a lot of use cases in healthcare. The imaging part, Ivo, is that what Siemens is really focused on, or is it other places as well?
No, as you know, Siemens is famous for building MRI, CT scans, and other devices. what we try to deliver to healthcare providers and users of the system is AI along a complete patient pathway. So it starts with like, when it comes to like scheduling, but definitely is helping radiographers to position patients, to speed up their workflow.
Yep.
And after the acquisition of the images, they will send to the reading place, where in between AI is working on calculations, for example, take away the manual burden. And then the next step is, of course, is combining all the data that is available for a patient, CT images, lab results, pathology results, data in EMR, etc., and then combine this and even go then beyond and try to help, okay, what's the best next step, so to say, for the patient when it comes to therapy, etc. So there we are like active along a patient pathway with several AI solutions.
Yep. I think the key point in all of this is that there are a lot of opportunities in healthcare specifically, right? So to your point, Piyush, pretty much every problem that you have data exists, right? So data is maybe one of the challenges in AI for sure, but any place data exists there's a possibility for a solution. If you can advance the slide, and then we'll talk a little bit about ChatGPT. You mentioned this in your thing, and it's got a lot of PR recently, right? So, I have mixed emotions about it, right? So I can see the value and some things that can be accomplished, but there's an opportunity, obviously, to use it for unintended consequences and to use it for bad things as well. But what do you think? Is ChatGPT for real, and how do you apply something like this to healthcare?
Yeah, I mean, ChatGPT is real, right? People are using it right now, so it's real. But I want to go back to the science behind this. So if you go to OpenAI website and you look at the paper that they have published prior to that, or you look at the publication around GPT-3s or 2s or so, all those are scientific publications. What you're seeing, what you're using is expression of those scientific work that has gone behind that. Is that 100% accurate? No. Should you be worried about or concerned about misuse? Sure. Like we have been concerned about misuse of nuclear energy. We have been concerned about misuse of gene editing. So any tool can be misused in some way or form, but it's for us to guard it. And if you think about the misuse, people were worried that many students will start using it to write papers and to write essays and all. And very quickly they came up with a tool, actually not just their OpenAI, but other organizations all came up with tools to figure out whether this was written by ChatGPT or not. So we'll develop those solutions. We will evolve. Look at the science behind that. I think that is, to me, more important. When I read the paper on InstructGPT, of course, the ChatGPT paper is not out there. It is very impressive. It's really interesting work that they have done over there. So it is going to evolve. And of course, it's real, in my opinion. Another point that I would make about its applications in healthcare. So I look at GPT's application in healthcare. I look at Transformers' application in healthcare. I did the coursework on Transformers in 2018. I have been using that since. My team has been using that since. And now there is PubMed GPT, there is BioGPT. There are so many GPTs. Rather, on 21st, we are doing an event with some authors of these papers and those who have done the work applying GPT to healthcare and learning from them. So it is real, it is here to stay, and it's up to us how we use it in the right way.
Suman, do you have any more comments?
I think, like Piyush said, most of the stuff that is definitely a hype, but also has base to it. So it's not like something is coming at you at a POC or a POT level. This is actually going into production in many organizations, as I know, from proof of concept to adoption of certain use cases. And we'll talk about some of those use cases. But my perspective has been, this is not a new concept that we're talking about here, right? When COVID hit us in 2020, right around March timeframe, I remember, we scrambled to put something together which is called chatbots for symptom checker, right? That's where pretty much doctors and clinicians got involved into something, automated way of letting people stay at home if they had, if they were sneezing, they were showing up in the emergency department. That's probably where we started saying, let's go through this analysis and have it more conversational and get you what you need. And that's probably was a big deal, right? And that's where I think chatbots really kicked in my mind into healthcare space. Then we talked about natural language processing or understanding as it goes through. Google Dialogflow does it, Microsoft Lewis does it, but it's again trying to mimic a human interaction. So that also was kind of introduced slowly through the transformation that happened during COVID time. Now ChatGPT comes with a whole different ballgame. But my point is, again, reiterating what I said in the beginning is, this is real. It's not going to get busted, but it's also going to have to go through the same cycles of trust, relevancy, accuracy, and then adoption will happen. So those are my initial thoughts around this, at least.
So I think Google's response to OpenAI is, hey, Bard is gonna come out soon, right? So I don't know when that's going to be released, but the BERT methodology, these are the science papers that you were talking about, Piyush, right? Versus GPT-3, it's a third generation already on GPT and leveraging that. Which one do you think, GPT-3 or BERT, which one applies to healthcare?
So I think those are two different models. One is just a base transformer model, that is the BERT, whereas GPT is actually generating information out of whatever data is there. So one is a generative model, the other one is just a transformer model. Both of them are being heavily explored for utilization in healthcare. We are actually using both. We are using BERT and different forms of BERT and GPT both. So I think the opportunities to utilize those for different use cases is enormous.
Awesome.
Yeah, and see, one other thing I'll just add quickly for 30 seconds is, as we introduce these new methods of care delivery, let it be chat or chatbot, what I think typically people underestimate or ignore sometimes is the impact with the operational readiness. Like if you introduce chat, which I think I was part of rolling out chat to talk to doctors, it can get overwhelming, and you always, as a user, expect somebody on the other side to respond to it. What do you do then, right? And I think that takes away the time to do clinical stuff, which they don't, and that could lead to burnout. So I think there are some nuances around it, how operationally you can roll it out versus what the features are. I think is important.
Right. What should people expect when they use a chatbot? Right? Is it like the automated phone messages you get when you call any place, right? Anyway, it's very frustrating as a consumer or as an end user to have an automated thing that you have to talk to. I usually tell most of them to let me talk to a real person, right? Because I need to generally explain a problem, and you don't have the ability to do that on the automated phone system. What about a chat GPT or a GPT application?
So I think the prior applications that you're talking about with chatbots were mostly rule-based. What you're seeing with transformers is how it is able to capture the context and able to use the learning from its training and then contextualize the answer to you. So you're seeing the evidence of that in your emails, right? So when you're trying to write an email, it finishes the sentence. So the same technology is coming to your chatbots now. Previously, it used to be rule-based. And previously, it used to be single words when you were texting that would prompt the next word. Now, because of the transformers, you're able to contextualize and finish the entire sentence with a particular context. So similarly, the chatbots are also evolving. They are evolving from rule-based to simple prompts to more contextual prompts.
There I see a very interesting example also, Steve. Currently, we do have a solution that's called similar patient search. That's when a doctor is looking at the chest CT, he might have the question, okay, what diagnosis do I need to make because I'm in doubt? they can put a circle around the area, and within a big database, all the information is like compared, and then the system is giving a proposal what could be like the other indication or diagnosis that is seeing. And of course, what we just learned from Piyush is like going into this like prediction part of you, and then it goes back to like the data. When we know much more about this patient, then of course the next step is being even more precise in supporting the radiologist with the diagnosis. Then it may be reducing it from 5 different opportunities or possibilities what the disease is to maybe just 2, because we know much more about the patient.
Awesome.
And that's definitely a future step. And I really have a strong feeling that we're going that direction.
Yeah, it's very awesome. The possibilities are just endless. If you could advance the slide, please. So, what do you see as the biggest opportunity for AI in healthcare? There are some. I think the graphic in here is basically about, are you delivering value today, or is it hype or in the future, right? So what do you see as the biggest opportunity for AI in healthcare?
So I think as a clinician, what I would want to see is how can I be assisted by AI in my decision making, whether it is looking through all the electronic medical record of a patient, which can be very vast, and pointing towards the right information, something as simple as that. Whether it can do the clinical note for me while I'm talking to the patient, so that I don't have to type, and I can converse with the patient just like we would usually, which the EHR or the electronic health record has partly taken away from us, thereby preventing things like burnout and being more efficient that way. So clinically, yes, those are the things that we are looking for. And of course, the quality and safety layer, that is something is always at mark. Can it be done can the care be provided in a safer way? So to give you an example, as an anesthesiologist, we do something called pain procedures, where we take a needle, we go to a particular spot where we need to deposit a pain medication so that the patient's pain is treated. Now, we use ultrasound these days for that. What if the ultrasound had a trajectory mapping and identified the structures that you were going to inject around or inject in? That is what has, that is kind of technology has already come there. It's FDA approved now. So does it improve the effectiveness of the pain procedure? Does it improve the safety so that I'm not injecting the medication at the wrong spot? Yes, those are the things that we're looking for clinically. But in the short time, as we develop those, I think the biggest impact is actually in the background, where can it help improve access to the patients? Can it decrease the administrative overload? Can it improve the quality of the data that we are dealing with? Because it's massive amount of data that we are starting to deal with. Can it help with insurance issues? That is something that we are researching right now. So all those administrative ones, which have a shorter cycle to get into work stream, are, I think, in the short run more likely to see wins, while the clinical ones need to go through the regulatory pathways, clinical trials, and see an impact.
Yep. And I think it ties back to what you said, Ivo, right? It either has to impact, patient care or create efficiencies in the health system. Cool. Do you guys have comments, Ivo or Suman?
Yeah, what I definitely feel from a global point of view, of course, you in the United States, you have a very good system with very experienced doctors, but still you see hospitals, they sometimes just don't have the experienced doctor when there's a CT scan done. So this consistency of care quality is a big topic. A hospital would love to deliver a certain quality, independent if the doctor is just fresh from university or has like 25 years of experience, or when the examination is taking in the middle of the night, or in the weekend when there was no doctor available. And that's also a big thing where we see with the help of AI, we can support institutions to have already a certain standard of quality of care. And that's then the base for the doctors to work on and work with.
Yeah, and see, my comments would be in line with what Piyush and Igor just talked about. But I'll go a little deeper, maybe a couple of use cases I would outline that I think is, we talked about earlier, what is the relevance of AI and how prevalent AI is in clinical systems. If you look at natural language processing being used in radiology notes, I was, again, privileged to be part of a team who built that, which basically predicted with, I would say, 78 to 82% accuracy in terms of a cerebral aneurysm just through by analyzing doctor notes using NLP, right? And that's just doctor notes. And the next phase was actually to add image analysis to it and make sure that the prediction goes up. What we're talking about here is curing cancer or predicting cancer and having preventive measures in there. Those are game changers, right? And I think these conversations that I had, I think they went live with production rollout, at least in a couple of regions, as I can recollect. The other one would be something that AI as an opportunistic implementation in medication adherence area, right? When you look into Medicare today, 40% of the revenue comes from medication adherence areas, right? And then Part D drugs. When you look at the population, you don't know if somebody lost a job or not. The doctor doesn't know. Doctor knows only a patient has been taking medications or not, or is sick or not. But when you lose your job, that first impacts your medication adherence rate because food becomes the priority, or in underprivileged areas, that's very, very, very relevant. So social determinants driven analytics could give you that insight. Applying AI on top of it basically pinpoints to the locations or areas where things are happening. So that's just the other one, and that could be that could lead to some kind of interventions, preventions, campaigns, and whatnot. And then the last one I would say is when you look into people calling for help and they have chest pain or bleeding, which are red flags in clinical terms. There are usually protocols involved where the call center analyst will escalate that to a nurse practitioner or a clinician. But in a digital setting, typically that is missing. So when people are trying to schedule an appointment without knowing that they could wait for 2 weeks, which should not be the case, there are digital interventions that could be introduced as well. So all I was trying to highlight is the opportunities that we have in these areas are tremendous, but more real than people think.
Awesome. Yeah, thank you for that. I think there's a lot of really, I'll say, positive uses of artificial intelligence to help create efficiencies and or improve patient health. So if you can move to the next slide. So what's coming, right? You mentioned, cancer treatments. I think from an advanced, I'll say, chronic, even health conditions perspective, right? There's a lot of research and there are a lot of things going on with AI in that regard. And cancer is certainly one of those, but pretty much any chronic condition, right? And I think Siemens just purchased a cancer company, right? So maybe you can start, Ivo, and talk a little bit about some of the things that are going on.
Yes, indeed. We are working together with Varian, the big the cancer therapy company, and there we are bundling sources in indeed bringing the best therapy for the patient. Of course, it starts a little bit earlier before therapy starts with, for example, programs we see with lung cancer screening. Of course, there are a lot of scans are done. AI can help to pick lung nodules, but of course, we all know that patients who smoke, 50% may die of cancer, but also 50% may die of cardiovascular diseases. So our software looks first in what's happening with the patient. And indeed, when there is a tumor detected, when any therapy is needed, the next step will be then starting the radiation therapy, where the planning needs to be done. A lot of organ contouring is needed for that before the radiotherapy treatment planning starts. And there also we have an AI solution helping the medical physicist in doing this for him or her, so that they save time there and increase accuracy. And then the next step, of course, is then where Varian comes into the play, where the whole planning is done, and also at the end, the radiation therapy. And there we see also with like the setup we have, as you were mentioning in the beginning, Steve, machine learning, AI is not new. We are working with it almost 30 years. So we have a huge data lake with also different data, so to say, beyond just images. And also there we looked in the topic, okay, how can all the data based on analyzing tumor forms, shapes, cells, etc., support the clinician in picking the right dose to make sure that you hit the tumor, but also have the right applied radiation dose, so to say, for that. And that's also a next step where we're also working together on there. The bundle of like having great images coming from modalities with the machines for Varian is definitely helping to beat cancer.
Awesome. Yeah, awesome. What would you add, Piyush or Suman?
No, I think Ivo is right. Like the biggest advances that we are seeing are related to cancer and imaging. That's what we've seen in our publications too. And there was an interesting paper that recently that I read that talked about publications are an early window to what's coming, right? Because that's where you are seeing what kind of research is happening, and that's going to come out. So that's why I put that paper that we recently put in preprint, the quantitative and qualitative evaluation. You can look at it. It will give you the entire spectrum for that. But to add to what Ivo said, one of the things that really impresses me, and this is something that has been heavily researched by Case Western Reserve University, the Anant Madhabushi's group. Of course, he went to Emory recently, but there's still additional work going on over there, is radiomics and pathomics. And I think those advances are phenomenal. So imagine you don't need a brain biopsy again. So you don't need to have anesthesia, and you don't need a surgery, somebody drilling a hole in your brain again to figure out if you have had tumor recurrence. I think that is phenomenal. So if you can just do MRI, and from that, you can tell whether this is tumor recurrence or this is just some inflammation or this is nothing that you need to worry about. Those kind of things really excite me because they make fundamental impact in patient lives and they improve quality of care, and they improve the safety of healthcare delivery. So I'm really excited about these innovations that are happening.
Yeah, I'll just quickly add, Steve, is we talked about the clinical side of chronic and episodic care management. There is also a patient side to it. What typically happens, and it's my experience when I was in San Jose Medical Center some days ago, the chief physician came and told us there's only one reason they're concerned about members' health is the readmissions. And they almost always come back with the same condition multiple times. And if it's a chronic condition, it's even serious because now it's not just about the cause, it's about the health of the member as well. So patient engagement can be influenced by AI, so that there's several tactics, and there are several organizations and companies formed around this to say, how can we boost patient engagement? How do we make it more interesting, more nudgy, or nudge-worthy, if there was such a word, to make them engaged into the platform, whatever platform that could be. And you can see those announcements coming out of United and others about how they would roll out certain things. Let's give a Fitbit to our members for being nice or being sticking to their regimen. The point I'm trying to make is there's a clinician side to it where image analysis and everything else is important, so the clinicians are on top of it. There's also a patient side to it where the patient engagement is the critical piece, where the doctor kind of recommends, say, hey, you do this for 2 weeks and come back. Well, the patient did not do that for 2 weeks, and guess what? They come back earlier with the same condition. So how do you improve both sides so they're kind of connected, and it's a full circle of chronic and episodic care management?
So interesting, Steve, if I may take a moment to piggyback on that. One of the things that we do from quality and patient experience point of view is do these surveys, the patient experience surveys. I just put a paper in the chat, you can look at it. We wanted to see how we can automate the analysis of these surveys, because we get like so many surveys. How can you automate that using AI? So interesting read, and this is something that we are looking to apply in healthcare.
Awesome. Yeah, awesome. If you could toggle to the next slide, please. So we've talked about opportunities in healthcare, which is there are a lot, right? So what about the challenges? Does anybody want to elaborate a little bit on challenges that you're currently dealing with, or what are the challenges in general in healthcare?
Yeah, I could go first, and maybe others. One of the things that I've always noticed in different entities outside is the next changes that this solution or this piece is going to help me in the long run. There is a lot of skeptical thoughts out there to say, I don't think the right thing, or I don't have time for this, right? So the culture kind of evolves from the trust that they have with the newer technology, let it be AI or even general technologies around analytics and BI, to say, yes, I'm going to embrace this for a short time. I will let my team do this as well. So it is kind of, it's prevalent in our area, and we will be the champions. So getting a champion is very important. That's number one. Number two is the data. I think data is all over the place, and you can only have good analytics or AI solutions if you have good data. When I say good data, I mean complete and accurate data. In my experience, there is no one organization I've seen who doesn't have data issues. Data management has been a pain point for lots of organizations and continues to be, because there is no standard mandate to do certain things or certain way, or saying this is the CPT code or this is the diagnosis code and it is stationed here, not everywhere. So that's the second piece. And third one I would say is the bias, right? When we do data sampling for AI, the first thing that comes to my mind is, how did you get that sample data, and is it free of bias? When I say free of bias, there is no such thing as free of bias. There will always be some bias. But are you getting to closer to a 90 to 95% bias-free sample, which could be gender neutral, which could be age neutral, and a bunch of other things, and then gets into the zone of coding bias, where you're coding something and you automatically introduce something that was not in the data. So how do you do that? And those were, I think, going to become more and more relevant as people start using these systems, AI-driven systems, and those are the ones to watch out for, I would say.
It seems to me that, like, the larger the sample size becomes, as data continues to increase, the less impact something like a bias will have. But it's a very real thing, right? So there are biases that are, I'll say, relatively obvious, right? So you don't want to sample all white males or all European males or all European females, or whatever the case may be, right? You don't want your sample set to be that. You want it to be diverse in those things. So those kind of biases are pretty obvious, I think. But I just read an article recently about, biases being beneath our conscious level, and we don't even know, right? But software developers probably have biases that they aren't aware of, or whatever, and they enter the code for these types of things. And so there can be biases that influence the outcomes of models that we aren't aware of going into it. What do you guys? What else do you think?
What I feel, of course, I work most of the time with like FDA cleared products that are in the field, but still, when you Google products for like chest CT, you find a lot of different companies, smaller, bigger ones, who are offering solutions, and there's still this trust issue. And there are definitely you see trends that are happening, that on bigger trade shows, conferences, you have again these face-offs. Certain data sets are shared to the different companies, and the outcomes are presented to the audience, where radiologists or experts are sitting, and they can objectively compare the outcomes and make up their own mind. Because it's still, we said, trust and seeing is believing. And also, like, topics in the past, when I started working on like the whole AI topics in 2018, we got a lot of questions about sensitivity, specificity, area under the curve, all these numbers. And also there, it's like super difficult to compare these numbers in an objective way, because the data that was like used for training could have a super image quality. It was easy to curate all the data. When an institution is creating different image quality, different image impression, you already have like a trade-off where the results are maybe not the same. So therefore, I'm a strong believer of like face off, let companies compete against each other with the same data set so that clinicians can have their own opinion on how good the product
So
is.
maybe we'll see a game show one day.
Yeah, I've been already on several ones. Yeah.
Awesome. What do you think, Piyush?
Yeah, I think from my perspective, I think Suman and Ivo summarized it well. One of the things that I see is related to adoption of these AI tools. So there are clear barriers because of either lack of knowledge of what they are supposed to do, or the understanding about how they come to that decision making, and that always worries clinicians. That I don't know what it does. It's telling me something, but I don't know if I should trust her, just like Ivo said or Suman said. But that at the baseline is about education, right? Like, so that we understand a little bit better, not just, okay, this is AI, this is something, but be able to read the scientific literature a little bit better and adopt it. So that's one part. And a lot of efforts from my team have been focused around building educational platform for this. And educating everyone, both sides, data scientists and the healthcare side. The other part of the adoption is the human-computer interface, and designing those in a way where people will have effective implementation of the decisions that are being provided to you. So we have learned from EHR, there are so many challenges in the way it is structured that many people, despite it having some novel solutions, try to walk away from that, or will just click something to override certain suggestions and all. So how do we develop these human-computer interfaces which clinicians will not get burnt out from and will be happy to adopt? And there are a couple of publications that have come about recently which discuss that. But I think to apply AI in healthcare, to have that translation occur, that we are in the phase where AI is here. A lot of research has already been done. That implementation science is still premature.
Yep. And you had to know I was going to bring this up, Piyush, right? But cybersecurity, I think, is huge, right? And if you think about it, like logically, it makes really good sense, right? As you add more devices or you add more data, you increase the surface area for an attack, and it's harder to deal with. So there are all kinds of challenges with AI. Software vulnerabilities, hardware vulnerabilities. There are a lot of things. If you could just advance the next slide, and I noticed that it's like 12:53, so we have 7 minutes left. We want to get some questions from the audience yet, but I want to go through this. This is pretty much the last slide, right? So the poisoning, you've probably all heard of this, and it's just amazing to me. Like, I read an article recently about a horse and a cow using AI to tell the difference between a horse and a cow, right? So all the horses that were fed to the model were brown, right? And the cows were all black and white. So if you showed a brown cow, the AI model would incorrectly call it a horse, right? So that's what data poisoning is really about, is really inflicting the data with a manufactured outcome, right? So whatever outcome you want. And I would say in radiology, poisoning can be severe, right? So you can either poison the data when you train the model, or after the fact, right? And just if you don't have lung cancer, you don't want to be told by your clinician that you have lung cancer, right? So I don't know. What do you guys think?
I'll be quick, and I think what I would say is AI poisoning is mostly around data poisoning. So if you look at what people do is they have red teams, and I haven't seen in a real world example where it has gone to an extent where there were ramifications, but there may be, I don't know. When I was reading upon it, one of the things that kind of struck me was how easy it is to manipulate sample data to influence your models to think differently. There could be one pixel attacks that they have, which is altering, like you said, a cow to a horse, and the model always identifies cows as horses. But if you take it more severe cases, which is AI being completely negatively influenced by these injection attacks, that makes you think a stop sign as a speed limit sign. so you don't stop, you go and hit someone, right? The LiDAR system can be, and this was done in one of those auto industry examples that I was seeing and reading papers on, is you can modify the LiDAR system to see the distance between you and the pedestrian to be much longer than it is. So you go and hit them. And those are the things are going to come into healthcare. Like you said, if somebody doesn't have lung cancer and then you recommend that some medication to be taken, assuming that he has lung cancer or going through that process, is actually very real. So to do that, I would say just make sure that you don't import any open source data or models to your sample set and code, and just be aware of it, train your employees, and make sure that they are looking into this as a holistic, like what could happen if I didn't do it right.
Yeah, that's an interesting point. It's a traffic science. What we definitely see is that the setup we have at Siemens Healthineers, we have a closed system, so to say. In Princeton, New York, there is our supercomputer, Sherlock, and that's a closed system where, of course, data gets in, but of course, there's still a lot of like manual power, clinicians working on the data sets and doing the curation, for example. So there's always this extra human eye looking at the data in the step of like the creating algorithms, training algorithms, etc.
Awesome. Let's open it up for some audience questions.
Hey, Steve, if there was questions, they would have had to put it in the chat over on the right-hand side, and I'm not seeing any specific questions in the chat to this point. So if we want to, I mean, we still have 3 minutes.
Okay.
We could always go to one more.
Yeah, let's move on. That we have a few upcoming events in healthcare that I thought were worth mentioning, right? On March 9th, we have an event in downtown Cleveland, Ohio. CISA is going to attend and speak about, does everybody know who CISA is? They're a critical infrastructure organization, part of the US government, and they have a lot of influence, I'll say, from a vulnerability standpoint, and various different techniques that they use or things that they'll perform, assist you in your incident response and those kind of things, tabletop exhibits, or exercises, they'll participate in them at no cost. So it's very good. And we'll have the head of Ohio, which is Region 5, I think, in the CISA organization, speaking. Taryn is a great speaker, and she'll be there for sure. On March 9th. Third-party risk, we're doing an event in later in March on the 23rd on third-party risk specific to healthcare. So a lot of the things that we talked about today from a challenge standpoint fall into the hands of third parties, and there's I'll say a mechanical way of really addressing that and making sure you have a structured program to deal with that. The HIMSS national event is coming up in April in Chicago this year. So Clay, maybe you'll say some more about this, but I just wanted to mention that as well. And then we'll also be attending AI Med, which is specific about AI, just much like the conversation today, specific to AI in medicine. Piyush is a member of that organization as well, and we'll be out there for that in San Diego. So we'll see you there. I think that's about it. So I want to thank all you guys for your attendance and closing remarks real quick, because I think we only have a minute left. So
yeah, I think, and we did have a few questions come in since we kind of pinged them towards that. If you guys want to, there's 4 of them in there. I don't know if we're able to answer all of them, but we can grab. I guess I'll grab a random one and let you guys, whoever wants to answer it quickly. So, can the panel recommend a good place to introduce AI into your healthcare system?
What do you think, guys?
I think there's one site I came across which is always fascinating to me. It always works on a laptop, I think, or a mobile device. I don't know which one it is, but it's called r2d3.us. Take a look at that. It's fascinating what it tells you, right? And people will get a kick out. It's very simple, but it kind of explains to you how AI works in real time. I'll highly recommend that.
So I think one place where you think about where you can introduce it is in the administrative area, whether it improves access or whether it helps with improving finances, because you can readily demonstrate ROI, and that's what C-suite wants to listen to.
Awesome. All right. Well, thank you, gentlemen, and thank you all as we close out today. Thank you all for being with us today. What a great topic that we covered in such a short time. And I can't thank you, Steve, enough for leading this discussion, and the rest of the gentlemen in terms of helping bring what a great topic to us in a panel style. As we do close out, I do want to remind everyone that, what has Steve mentioned before, coming in April, we do have the National HIMSS event coming up. So if able, please take the opportunity to sign up that and attend if able. And I also wanted to give a quick plug around our next event. So be on the lookout for our next in-person event that we have coming in early June. We are currently in the planning phases of that. And just know that as we go closer, our No HIMSS members will be getting communication around that and around the specifics of the topic. And you should be getting that good to go. All right. Well, I hope you all have a wonderful afternoon, and thank you.
Awesome. And I'll just mention one thing, Clay, if I can. The questions, I just grabbed them. I think they're in the comments section. I just grabbed all the questions, and we're happy to answer all of them. And I think we'll send the slides out. But if you could make sure that your email address is available, and we'll try to answer the questions.
Thanks, everyone. Thanks, Steve.
Thanks for attending.
Have a good
Thanks, you
afternoon.
guys.
Bye-bye.
Thanks, panel.
Thank you.
Thank you so much.